So when building that practice element then, and if having an A scan is essential, and if axial length is an important component of a myopia control practice, then what does the future look like in measuring for axial length? Like, how much of an impact is this going to have overall? Is this is just one more tool in the toolbox, or is this going to become a dominant feature of managing myopia in the future?
I think it's a dominant feature. So I put more weight in my axial length measurement than I do in my refraction. It's an objective measurement rather than subjective, and I feel like it is not influenced by factors such as atropine, for example. When a patient starts atropine, we're still not sure exactly how atropine works, but one of the predominant theories is that there are some structural changes that happen within the eye that cause some sort of remodeling of the eye that can cause a shift of the lens iris diaphragm. Well, when that shift happens, it can cause a hyperopic shift in refraction. Well, that throws your refractive data off. But I know that the axial length measurement, if it's done with a proper instrument, is going to be very, very accurate. So again, let's go back to the example of glaucoma. Am I going to make a clinical decision on treatment based on changes in a patient's visual field? I'm much less likely to do that because we know that those fields aren't always repeatable. We know that they're very subjective, but I'm much likely to make a treatment decision based on changes in the nerve fiber layer thickness that are measured, with that OCT scan. I feel the same way about axial length. I think it's super important.
I see. So in your opinion, everybody needs to be measuring for axial length then?
I mean, I don't want to tell other people what to do, but I think it's, in one sense I don't, but my friends who know me best will say I do tell them what to do. I tell them, dude, you got to get your axial length. You got to get it. Because I just do feel really strongly that it's really important. In addition, I think the doctors who are going to be seen as the best at what they do are going to be the ones that have those better technologies and are measuring those things.